Let us continue our journey in solving the MCQs of BCBR, that is Basic Course in Biomedical Research. Now let us continue with the 13th chapter, that is Selection of Study Population. To start with the first question, selection of study participant depends on, the options are A, representativeness, B, acceptable cost, C is adequate size, or D, all of the above. So what is the answer for this question? The answer for this question is all of the above. Selection of the study participant depends on all of the above. See this chart. The study subject and population connecting the link. It is representative 1, second is acceptable cost, third thing is adequate size. And in our question, they have spoken regarding the representativeness, acceptable cost, and also the size. So we have taken the answer as option number D, that is all of the above. Okay. So all these three things, they are for the study participants. Now the second question, target population is determined by what? Options are A, demographic characteristics, B, temporal characteristics, C, clinical characteristics, or D, both A and C. Both A and C. So what is the answer for this question? The target population is determined by both A, demographic characteristics, and C, clinical characteristics. So therefore option number D is the answer for our question. Now see this chart. The target population is determined by both demographic characteristics and clinical characteristics. See over here, this target population is characterized by both demographic and clinical. Now the whole and soul, this population and sample chart should be kept in your mind. Everybody have to by heart this chart, and if possible I suggest you practice this chart 3 or 4 times so that it can fit inside your brains, because invariably one question or two question will definitely be asked from this chart itself. We will come across many questions in this chapter pertaining to this chart, but as far as our question is concerned, the target population is determined by both demographic characteristics and clinical characteristics, which is being seen from this chart. Okay, please remember this answer and the question. Next question, study sample is a subset of accessible population. Is this a true statement or a false statement? So once again let us go to the chart what I have shown previously. See, the question was, the study sample is a subset of accessible population, and we got the answer. The study sample is a subset of accessible population. It is a subset of accessible population. So therefore the answer is that the statement what they gave is a true statement. It is a true statement. Please remember this answer and the question. Okay. Next question, representativeness of a study sample refers to what? The options are A, the extent to which the characteristics of the sample accurately reflect the characteristics of the population, or B, the size of the sample which is large enough, or C, volunteering the nature of subjects from the population, or D, the extent to which the characteristics of exposed population accurately reflect the characteristics of unexposed population. The size of the sample which is large enough, this doesn't match, so therefore this should not be the answer. Secondly, volunteering nature of the subjects from the population, it is not volunteering, so even this is not the answer. Now it is between A and D. So representativeness of a study sample refers to the extent to which the characteristics of the sample accurately reflects the characteristics of the population. Is this the statement? Or the extent to which the characteristics of exposed population accurately reflect the characteristics of unexposed sample they mentioned over here. So therefore even this is not the statement. So we got the answer for our question, that the representativeness of a study sample refers to the extent to which the characteristics of the sample accurately reflect the characteristics of the population. Please remember, this is how you have to answer the question, and this is the answer for this question. Let us go to the next question. Now the next question, Non-response in a study can be minimized by what? The options are A. Repeat the contact of the study participants, or B. Providing compensation for participants' time, or C. Less invasive and less sensitive questionnaires, or D. All of the above. Let us see the options again. Repeat the contact of study participants. Yes, this is correct statement. Second, providing compensation. Yes, definitely correct statement. Third is less invasive and less sensitive questionnaires. Yes, even this is correct statement. So therefore, the answer for this question is D, all of the above. D, all of the above. Let us see in the chart. Now see this chart pertaining to the non-response in a study. It speaks about the issues and also the tips to minimize the non-responses in a study. Now from our options, the first option was repeat contact of study participants. So this is written over here as the first statement itself and has been given as an option in our question, repeat contact attempts. Then the second option, that providing compensation for the participants' time. Even this is mentioned over here in the form of incentives. Then third option, that is less invasive and less sensitive questionnaires. Even this has been mentioned as bilingual or translated questionnaire for the interviewers. So all these three options are available and they are the tips which can minimize the non-response in a study. One more option which can be asked in any question is like a design that avoids discomfort to the participants. Even this is one of the questions. So all the students, please be perfect with this chart regarding non-responses in study, the issues pertaining to this non-response in a study, and also the tips to minimize the non-response in a study. Next question. External validity means what? Option number A. The degree to which the inferences drawn from a study can be generalized to a broader population beyond the study population. Or B. The degree to which the observed findings lead to correct inferences about phenomenon taking place in the study population. Or C. The degree to which a test actually measures what is designed to measure. Or D. The degree to which the findings are reliable. So what does external validity mean? So the external validity means option number A, that is the degree to which the inferences drawn from a study can be generalized to a broader population beyond the study population. Most important, the catch is whenever in the options, if they use the term generalizable or generalized, if this is the option, if this word is used, then blindly you can take that sentence as the answer for external validity. Chalo. The next question. Participants may be excluded from the study because of. The options are A. Interference with the success of study follow-up, or B. Ethical concerns, or C. Interference with the quality of data collection, or non-acceptance to participate in the study, or all of the above. So what is the answer for this question? The answer for this question is all of the above. Once again, let us see. The participants may be excluded from the study because of either interference with the success of study follow-up, or B. because of ethical concerns, or because of interference with the quality of the data collection, or non-acceptance to participate in the study. Now see the information given in the next slide. See here in the selection criteria, in this slide of selection criteria, see regarding the subset of individuals, they might interviewer or success of follow-up efforts, the quality of data or acceptability of the randomized treatment. Okay, so once again, if we go back to our question, they have spoken regarding with the success of study follow-up. Okay, then interference with the quality of the data collection, or non-acceptance to participate in the study, or non-acceptance to participate in the study. See, it is written over here, the quality of data. These are the words which have been used, quality of data. Okay, quality of data, success of study follow-up, success of follow-up, study follow-up, it is written over here. Okay, so all these things come under the exclusion criteria. They come under the exclusion criteria. Please remember this chart. This chart is very important. Okay, this chart is very important. Next question. While choosing the accessible population and the sampling approach for selection of study population, an important factor that we need to consider is what? A. Simplicity, B. Technology, C is feasibility, or D is reliability. So what do you take into consideration? The answer for this question is option number C, that is feasibility. We take feasibility into consideration. Feasibility is an important factor to consider in choosing the accessible population and sampling approach. Straight away they have given whatever is there in the question. See the question. While choosing the accessible population and sampling approach for selection of study population. That was an important factor. Okay, that was an important factor to consider choosing the accessible population and sampling approach. So when you get this question into examination, then you have to take feasibility as the answer. Okay, take feasibility as the answer. Please remember this chart of recruitment. Okay, next question. If your research question is related to diagnosis, treatment or prognosis of a severe medical condition, then it is easy and cost effective way to recruit the study population from the community. Is this a true statement or a false statement? The answer is that it is a false statement. It is a false statement. Now see the chart below. In this chart, it is clearly mentioned that it is, see the fourth part. It is difficult and expensive to recruit. Okay, it is difficult and expensive to recruit. But in the question, they have informed that, or they have said that it is an easy and cost effective way to recruit the study population. So therefore we told that it is not easy and not a cost effective way. So therefore this statement is a false statement, and you have to please keep this chart into mind, where we have seen that it is difficult and expensive way to recruit the population, study population from the community. Next question. Reasons for interference with the success of follow-up in a study may include what? Options are A. Migration of some study participants from the study area, or B. Marriage of some of the female study participants because of which they might move out of the study area, or C. Refusal for follow-up, or D. All of the above. So what are the reasons for interference with the success of follow-up in a study? Let us see the options again. Migration of some of the study participants from the study area, yes. Then marriage of some of the female participants, then they might move out from that area, yes. Third is refusal for follow-up, yes, even this is correct. So all of the above statements are the reasons for interference with the success of study follow-up in a study. Next question. The population defined by clinical and demographic characteristics is called as what? A. Target population, or B. Accessible population, or C. Subset, or otherwise D. Study sample. So we have seen this previously. It's a repeated question. The answer for this question is A. Target population. See over here. The question was asked that the population defined by clinical and demographic characteristics. Population is defined by clinical and then demographic characteristics is called as the target population. Okay. Chalo. The next question. Next question. The population defined by geographical and temporal characteristics is called as what? The options are again the same. A. Target population, B. Accessible population, C. Subset, or D. Sample size. So what is the answer for this question? Let us see the chart again. They have asked that the population which is defined by geographical and temporal characteristics, is called as accessible population. So this is the question. Okay, geographical and temporal characteristics is called as accessible population. So we got the answer over here. Next question. What is the difference between a sample and a population? The options are A sample is larger than a population, or B, a population is a subset of a sample, or C, a sample is a subset of a population, or D, that there is no difference between a sample and a population. So what is the answer for this question? The answer is that a sample is a subset of a population. Option number C. Please remember this answer. Sample is a subset of a population. Next question. A researcher found an inference about a particular disease of interest. So if he or she wants to generalize the results, then it is important to have what? A. Internal validity, B. External validity, C. Feasibility, or D. accuracy. I have mentioned previously that whenever you come across the word generalizable or generalizability or generalized, and if in the options they give you the word or the term external validity, then you take that answer into consideration. Okay, then next question. Which term describes the process of recruiting the participants who meet the certain criteria? Okay, sampling, B. randomization, C. recruitment, or D. stratification. Sometimes the examiner will give such a simple question and will try to misguide or confuse the students. They themselves have told which term describes the process of recruiting the participants. This is done in something called as recruitment. Okay, chalo. Next question. What is the key ethical consideration in selecting a study population? The options are A. cost effectiveness, B. ensuring the informed consent, C. randomization the sample, or D. avoiding the statistical analysis. So what is the key ethical consideration? Ethical. Whenever you are speaking about ethical in selecting a study population, what will come? We have seen this in other chapters also. The answer will be ensuring the good and informed consent. Informed consent is important whenever ethical issues come into consideration. Next question. Select a correct statement regarding achieving a representative sample. Okay. Now the options are A. begins at the design phase and ends at the implementation phase, or B. begins at the implementation phase and ends at the design phase, or C. choosing populations are done in implementation phase, or D. choosing the sample methods are excluded from the design phase. So select a correct statement they have said. So that means that all the other three statements are wrong, only one statement is correct. So what is the correct statement? So here you can use the exclusion criteria how to choose the best two of four options. See, option number A and B. Option A says that begins at the design phase and ends at implementation phase, and option B says begins at implementation stage and ends at the design phase. So by this itself I have understood that the options or the answer will be either from A or B. So straight away exclude C and D. Okay, so now the answer for this question is option number A, that is it begins at the design phase and ends at the implementation phase. Now you see the chart over here. So this chart is showing regarding achieving a representative sample. It shows both the design phase and the implementation phase, and as the rule says, it says that it begins at the design phase and ends at the implementation phase. It begins over here and it will end over here. It begins over here and ends over here. Please remember this point. Okay. Chalo, next question. What is the first step in selection of study population? The options are A. sampling procedure done initially, or B. derive the subset of accessible population, or C. define the target population, or D. form a recruitment strategy. So what is the first step? The first step is, first of all, you have to define the target population, that is option number C. Now see the chart below. See here, these are the steps of selection of a study population, and the first step itself speaks about the target population. Okay, so from our options, the option number C, that is defining of the target population, is the answer of our question. So I request all the readers to have a look and study this chart, because this chart invariably one question may be asked from this chart. Okay. Next question. Which of the following is incorrect pertaining to selection of a study participants? Options are A. random error control, B. cost acceptability, C is representativeness, or D. inadequate size. So which of the following is incorrect pertaining to the selection of the study? Answer is D. inadequate size. Inadequate size. If you can remember, in our first question itself, we have spoken regarding the study subject and population. We drew a diagram. There was a diagram of representativeness, and then acceptable cost, and then size. Okay, all these three were interlinked to each other. So therefore, from the options, the incorrect part is inadequate size is incorrect. Otherwise, adequate size is the correct answer. Now see the chart over here. See this chart as I have told you. Representativeness, acceptable cost and adequate size. But in the question they have mentioned inadequate size. So therefore this was our answer for this question. Next question. What is the term for the population from which a sample is drawn? Okay. Options are A. Sample frame, B. Target population, C. Accessible population or D. Control group. So what is the term for the population from which a sample is drawn? So the answer for this question is C. Accessible population. C. Accessible population. Please remember this answer. See this chart below. The question was, what is the term for the population from which sample is drawn? So you are drawing the sample. Okay, so what are all came in between? There came a big population, then a target population, then accessible population. A subset is the sample, the study sample. Okay, so just before the study sample, you will have the access population. So the answer for this question was access population, not the target population, not the control group, and not the study sample frame. Okay, please remember this answer. Now the next question. Which of the following sampling methods is most likely to produce a biased sample? Sampling methods, okay. The options are A. Simple random sampling, B. Stratified sampling, C. Convenience sampling or D. Systematic sampling. So which of the following sampling methods is most likely to produce a biased sample? The answer is C. Convenience sampling. Next question. In qualitative research, what is the focus of the study population? The options are A. Quantitative data analysis, B. Participant experiences and perspectives, C. Large sample sizes or D. Control groups. So in qualitative research, what is the focus of the study population? The focus of the study population is option number B, that is participant experiences and perspectives. If this question comes in the examination, please remember this answer. You mug up this question and this answer. The next question. An investigator intends to estimate the prevalence of UTI among circumscribed children who are less than 5 years old in Jaipur city. However, the researcher selects the study participants from one government hospital. So which of the following is the target population in the study? Is the target population. Please remember the target population in the study. Okay. So the options are A. All the circumscribed children less than 5 years attending the government hospital, or B. All the circumscribed children less than 5 years in the city, or C. All the children aged less than 5 years in the city, or D. All the children having UTI in the city. Okay. So in this context, when this question is asked in the examination, you have to remember the chart. Let us go back to that diagram once. Now see this diagram over here. When such a type of question is asked, you have to keep this diagram into consideration also, because you see what they have asked, which of the following is a target population. What was the target? This is the target population. Target population came out of main population. We will substitute all the entities over here. First thing will be the main population, out of which you had the target population, and then you have accessible population. What is the main population? What do you think among the options A, B, C and D? I will tell you. The main population is option number C. Okay, that is all the children less than 5 years of age in the city. All the children, please remember this point. This is the main population. Now what is the target population? Target population comes when you have clinical and then you have demographical characteristics. What is the clinical characteristic? Circumcision, circumscribe. And what is the demography? Jaipur city. Jaipur city. Okay. So the main population was all children less than 5 years of age in the city. Clinical is circumcision, and then demography is Jaipur. So what is the answer for our question to get to the target population? Out of all the children of less than 5 years of age in the city, the circumscribed children less than 5 years of age in the city is the target population. So that means option number B is the answer for our question. Option number B is the answer for our question. See, the first sentence of the question itself, that the investigator is intending to estimate the prevalence of UTI among circumscribed or circumcised children less than 5 years in Jaipur city. So in the question itself, he gave the answer that the intending was to target circumcised children less than 5 years of age in Jaipur. So this was the answer for our question. Then what is accessible population? He was intending to estimate in the whole Jaipur city. But unfortunately, the researcher selects the study from only one government hospital because he had accessibility to only one government hospital. So therefore, the accessibility population or the accessible population will be option number A. That is, all the circumcised children less than 5 years of age attending the government hospital is the accessible population. So please remember how to solve such sort of question. Main population is what, target population is what, and accessible population is what. This is a good example or a good question for to answer such type of question. Next question. Which of the following is the accessible population in the above study? Now you see the same study, okay, but now they have asked the accessible population. Now let us see the options again. A. All the children aged less than 5 years in the city, or B. All the circumscribed children aged less than 5 years in the city, or C. All the circumscribed children less than 5 years attending the government school, or D. All the children having UTI in the city. The target population was the children in the city. Now see here, what was the accessible population? Accessible population came out of the target population. Okay. Now because of the geographical and temporal characteristics, what was the geographical and temporal characteristics in this question? It is the government hospital is a geography in from one area only. So the answer for our question will be all the circumscribed children less than 5 years of age attending the government hospital. This is the answer for this question. Next question. State whether true or false. High non-response rate in a study may affect the internal validity. Is it a true statement or a false statement? The answer for this question is that it is a true statement. High non-response rate in the study may affect the internal validity. Now you see in this chart, the issue is that high non-response rate, as the question asked, if the non-response rate in the study is high, then it will definitely affect the validity. It influences the validity and interfering the sample represents the population. Okay, please remember this point. This was the question which was asked over here, and therefore we have taken as true as the answer for this question. So next question. What is which of the following is true about study validity? The options are A. An internal valid study result is always generalizable to the target population, or B. An internal valid study result may or may not be generalizable to the target population, or C. An external valid study result is not generalizable to the target population, or D. A study without an internal validity can be generalized to the target population. So all generalizable terms are being given in each and every option. Let us see again which of the following is true. Options are as follows again. An internal valid study result is always generalizable to the target population. No, this is not true. An internal valid study result may or may not be. Yes, may or may not be. As I told you previously, what is always is not always. Okay, so therefore we have cancelled the first option. In the second option regarding internal validity, may or may not be generalizable to the target population. Yes, so this is the correct statement. Let us see the other two statements. An external valid study result is not generalizable to the target population. So even this is wrong statement, because external valid study result is always generalizable to the target population. This was the definition of external validity. The last option, a study without internal validity can be generalized to the target population, is also a wrong statement. So option number B is a correct statement. Now see the chart over here. See this circle over here. Internal valid results are not necessarily be generalized to the target population. So not necessarily in the sense it may or may not be generalized to the target population. So therefore this was our true statement. Okay. Next question. Which factor is least likely to affect the selection of the study population? Options are A. Research question, B. Availability of study participants, C. Weather conditions, or D. Ethical considerations. Least likely is weather conditions. Weather conditions are least likely to affect the selection of study participants. Next question. State whether true or false. Biases can affect both the internal and external validity. Is it a true statement or a false statement? Definitely, it is a true statement. Next question. In a community-based vaccine trial, which aims to compare the one-year incidence of intussusception in children receiving or not receiving the rotavirus vaccine, which of the following can be a likely exclusion criteria? Okay. So the options are as follows. A. Children who may leave the study area within 1 month. Or B. Children aged 0 to 24 months. Or C. Children without pre-existing intestinal anomalies. Or D. Children who have not received rotavirus vaccine previously. So which of the following can be likely an exclusion criteria? So one is out, other three are in. Okay. The answer is option number A, that is children who may leave the study area within a month. Okay, because they are going away from the area. If they are going away from the area, then that is surely an exclusion criteria. You have to leave them. The next question, in a cohort study planned to estimate the incidence of birth defects among the Zika virus infected pregnant women in Chennai city, which of the following cannot be an inclusion criteria? Cannot be an inclusion criteria. Options are as follows. A. First trimester pregnant woman with lab confirmed Zika virus infection. Or B. Pregnant women who are permanent residents of Chennai city. Or C. Pregnant women aged above 18 years. Or D. Pregnant women taking drugs known to cause birth defects. So which women cannot be an inclusion criteria? The answer for this question is option number D. Pregnant women taking drugs known to cause birth defects. If you know any pregnant women who are already taking medications which are liable to cause birth defects, then you remove them. You exclude them. You will not make them into an inclusion criteria. But let us see the other options. Pregnant women above 18 years, yes, they are liable to acquire infection. Then pregnant women who are permanent residents of Chennai, yes, even they are likely to get infected with Zika. Third one is the first trimester pregnant woman with lab confirmed Zika virus infection. All these three entities are one and the same. Okay, all these three entities are one and the same except the D1, that is women who are liable to get birth defects because of known medications. Chalo. Then next question. What is the role of inclusion criteria in a study? The options are A. To define the population that will be included, or B. To outline the specific characteristics required for participants, or C. To ensure a diverse sample, or D. To limit the sample size. So the answer for this question is, what is the role of inclusion criteria? It is to outline the specific characteristics required for the participants. Specific characteristics required for the participants. Okay. Then next question. Less invasive and less sensitive questionnaires will do what? Let us see the options. A. Increase the power. B. Decrease the power. C. Improve the significance. Or D. Reduce the non-response. Less invasive and less sensitive questionnaires will do what? The answer is D. It will reduce the non-response. It will reduce the non-response. Please mug it up. Next question. In what type of research is snowball sampling commonly used? See, once again, this question is from the 11th chapter actually, but if it has been repeated over here, so let us finish this question here. So in what type of research is snowball sampling commonly used? The options are A. Experimental studies, B. Large scale surveys, C. Qualitative research, or D, cross-sectional studies. So in which type of research? The answer is very clear. It is used in qualitative research. It is used in qualitative research. Okay. Then next question. What is the key disadvantage of convenience sampling? Key disadvantage they are asking, not the advantage. Okay. Options are A, it is time consuming. B, it may lead to a non-representative sample. Or C, it is difficult to implement. Or D, it requires advanced statistical methods. What is the disadvantage of convenience sampling? The answer is that B, that it may lead to a non-representative sample. It may lead to a non-representative sample. Next question. In research, what does the term demographics refer to? Demographics refer to what? Options are A, the statistical data of a population. B, the ethical guidelines for a research. C, the methods of data collection. Or D, the theoretical framework of a study. Option number A, the statistical data of a population. The statistical data of a population. Okay. Then next question. In which type of study would you most likely use purposive sampling? Purposive sampling. Options are A, survey research. B, experimental studies. C, qualitative research. Or D, randomized control trials. The answer is C, qualitative search, qualitative research. Okay. Previously, also we have seen a question on snowball sampling. Snowball sampling also the answer was qualitative research. Now purposive sampling is been given as a term. Over here also the answer is qualitative research. So please remember this answer. Next question. What is a sampling frame? It is a list of all the possible participants in the target population, or a method for selecting participants randomly, or a statistical method for analyzing the data, or a framework for ethical consideration. So what is a sampling frame? So you should not get confused or get carried away with the word frame and take framework as the answer. So this is not the answer. Definitely the answer of sampling frame is that a list of all the possible participants in the target population. So option number A is the answer. Option number A is the answer. Okay. Next question. What term describes the phenomenon where participants drop out of a study over time? Where participants drop out of a study over time. Options are A, attrition. B, selection bias. C, randomization. Or D, stratification. So what is the answer for this question? Phenomenon where participants are dropping out of a study over time is called as attrition. It is called as attrition. Okay, please remember the answer for this question. Next question. What does power refer to in statistical terms related to the sample size? Options are A, the ability to detect a true effect. Or B, the size of the sample needed. Or C, the strength of the relationship between the variables. Or D, the number of participants who complete the study. Power refers to the ability to detect a true effect is the answer. Okay. Next question. What is a disadvantage of using a small sample size in research? It will lead to bias. Options are A, increased costs. B, greater likelihood of bias. C is enhanced validity. Or D is easier data collection. As I already told that it will cause bias. So greater likelihood of bias if you take a small sample size. Then next question. What is the purpose of using a sampling frame? Again, repetitive question. Okay. So the answer is straightforward. To create a list of all the potential participants we have just now seen. Then next question. An investigator intends to estimate the incidence of long COVID among adult patients who recovered from COVID-19 in Bengaluru. However, the researcher selects the participants from a tertiary care hospital, that is XYZ, in the city. The accessible population in this case would be whom? A, adult individuals in the city. Or B, adult COVID-19 patients in the city. Or C, Adult patients who were managed and recovered from COVID-19 in the tertiary care center or XYZ in the city, or D. Adult COVID-19 patients managed in the tertiary care hospital XYZ in the city and who developed long COVID. So what is the accessible population? Please go back to the chart, okay, and try to analyze the chart, putting all these variables in the chart. So you will get the answer. The answer is option number C. That is adult patients who were managed and recovered from COVID-19 in the tertiary care hospital in the city. We are speaking about the accessible population. We are speaking about the accessible population, not the target population. See, let us have a more clarity on this issue. This is the total population. Okay. First is total population or the main population. Then you have the target population. Okay. After the target population, what you have? You have the accessible population. Accessible population. So the investigator is intending to estimate the incidence of long COVID among adult patients who recovered from COVID-19 in Bengaluru. So already Bengaluru has been decided. So clinically and demographically, after you apply these two characteristics on the total population, then you come out with the target population. The target population is nothing but the first statement itself, that is the intention to estimate the incidence of long COVID among adult patients who recovered from COVID-19 in Bengaluru. So we got the target population, but they are asking for the accessible population because the researcher selects the participants from a tertiary care hospital. That is only one area he is selecting, one place, that is a tertiary care hospital, because these were accessible. So the question itself is asking the accessible population is who? So option number A doesn't apply, that all the individuals in the city is not. Once again, option number B is also not applied because city, you remove both of them because we know that the accessibility was only in the tertiary care hospital. Then among option C and D, why have we chosen C? Now C, option says that adult patients who were managed and recovered, see the word, recovered from COVID-19 in the tertiary care hospital in the city. So option number C was selected. Whereas option number D, that adult COVID-19 patients managed in the tertiary care hospital in the city who developed long COVID, there is no mentioning of any recovery terminology in this option number D. So therefore, option number C is the answer for our question. The next question, which among the following is incorrect about non-response while collecting data for a research study? The options are A, it is generally higher in observational studies, or B, it compromises the generalizability of the study, or C, it can be minimized by study method that avoids discomfort to the patients or participants, or D, it tends to change the objective of the study. So what is incorrect about the non-response? Rest of the other three are correct. Let us see the options again. It is generally higher in observational studies. Non-response. Yes, this is the correct statement. Second statement, it comprises the generalizability of the study. Yes, it compromises the generalizability of the study. And third one, it can be minimized by study method that avoids the discomfort to the participant. Yes, even this is correct because this was a previous question in this chapter we have seen previously. So definitely it is option number 4, that is it tends to change the objective of the study, is the incorrect statement about non-response. Next question, all of the following participants can be considered as inclusion criteria for a trial evaluating the efficacy of drug treatments for PCOD except what? Options are A, females in the reproductive age group, or B, females with mild PCOD, or C, females with severe PCOD, or D, females with PCOD and under treatment. So what was the question? All the following participants can be considered as inclusion criteria for a trial evaluating the efficacy of drug treatments. You are trying to evaluate the efficacy of drug treatment. So therefore, some new drug you are planning to put in. So all of the following participants can be considered as inclusion criteria except. So all three are included except one. So it is clear from the options that option number D is excluded because this patient is already under treatment, while the rest of the three categories will be given a new treatment. Okay. Chalo. Next question. An investigator wants to study the coverage of COVID-19 vaccination program in a selected district. A representative sample can be obtained by all of the following steps except. Okay. Options are A. Choosing the population and sampling methods wisely, or B. Guarding against the errors in applying the inclusion criteria, or C. Monitoring the adherence to the criteria as the study progresses, or D. The number of vaccine vials supplied to the district. So a representative sample can be obtained by all of the following except what? It is clear from the options. There is nowhere consideration of number of vaccine vials supplied to the district. Okay. So choosing the population and sample methods wisely is correct. Guarding against errors is correct. Monitoring the adherence to the criteria is correct. Okay. Number of vaccine vials is nowhere related. Chalo. Next question. Which of the following is a potential consequence of poorly defined study population? What is the consequence of a poorly defined study population? Options are A. Increased sample size, or B. Higher statistical power, or C. Reduced external validity, or D. Improved participant recruitment. So what will happen? What is the consequence of a poorly defined study population? The answer is reduced external validity, because you cannot generalize the results to the population. Okay, please remember this point. Next, all of the following are guiding principles for selecting the suitable study population except what? So three are correct, one is wrong. The options are A. The selected study population should be a representative of the target population, or B. It is better to select the entire target population wherever feasible, or C. The cost and time involved in selection should be reasonable, or D. The number of participants selected should be sufficient to account for random error. So which of the following are guiding principles? Let us see the options again. The selected study population should be a representative of the target population. Yes, this is a true statement. Second, it is better to select the entire target population wherever feasible. Entire, and wherever feasible, it is not feasible. So therefore, this is the answer for this question. Let us see the third option. The cost and time involved in selection should be reasonable. Yes. And the number of participants selected should be sufficient to account for random error. Yes, even this is correct. So therefore, this option number A, option number C, and option number D are the guiding principles for selecting the suitable study population, except option number B, because it is better to select the entire target population wherever feasible, is a wrong statement, and not a guiding principle. Okay. Then next question. What is meant by exclusion criteria in a research study? Options are A. Characteristics that define the target population, or B. Factors that disqualify potential participants from a study, or C. The criteria that promote diversity in the sample, or D. Guidelines for ethical recruitment. So what is meant by exclusion criteria in a research study? You will exclude those people who disqualify. So factors that disqualify potential participants from a study. So this is the answer for this question. Okay. Next question. All the following are important factors to be considered while choosing a study sample and sampling approach except what? The options are A. Feasibility, B. Representativeness of the target population, C. Is sufficient numbers to test the proposed hypothesis, or D. Identification details of individuals of the target population. While choosing a study sample and sampling approach, all are the important factors except what? Let us see the options again. Feasibility, yes. They should be representative, yes. Sufficient number should be present? Yes. After this, identification details of individuals of the target population? No. This is not a factor to be considered while choosing the study sample at this stage. While choosing the study sample stage, individual identification is not required at this stage. Okay, it is required at later stage but not at this stage. Let us see the last question. Which among the following is incorrect about selection of sample for conducting a research study? Options are A. Demographic and clinical criteria are applied to identify the target population, or B. Exclusion criteria are applied to eliminate the subset of accessible population who may not be appropriate to be included, or C. The random sampling is not possible for hospital-based selection of study participants, or D. Non-responses in a study affects the generalizability of the study. So, which of the following is incorrect? Incorrect about selection of sample for conducting a research study. Let us see the statements again. Statement number A. The demographic and clinical criteria are applied to identify the target population. Yes, this is a correct statement. Or B. Exclusion criteria are applied to eliminate the subset of accessible population who may not be appropriate to be included. Yes, even this is a correct statement. Then third, random sampling is not possible for hospital-based selection of study participants. This is definitely incorrect because random sampling can be possible. Okay, so this is the answer for our question. Then let us see the last option. Non-response in a study affects the generalizability of the study. Yes, this is also a true statement. This is also a true statement. Okay, so we have completed all the 50 questions in this chapter. With this, we complete the chapter on selection of study population. So, chapter number 13 is over. Thank you.